Hi guys, Cam back here again. We're on the workshop, not on about the workshop. I thought I'd give you an update as to where I'm at post-surgery for my prostate removal due to cancer. On Thursday I went and saw my specialist. That's 2 months since I had the operation, 2 months to the day almost that I had the operation. Last week I went and had my blood test done and I got the results from my surgeon on Thursday afternoon. And I'm very happy or very relieved to say that it is a 0 level on the PSA, so that's an undetectable level. So very, very relieved and very, very happy. What that basically means in real terms was that there is no cancer present pre-op. PSA tests can be a little bit of a blunt knife if cancer is detected due to a rising PSA level. You don't know whether that cancer is due to a spread outside the prostate or whether it's still inside the prostate. So with the prostate removed and the 0 level means that there was no cancer present pre-op. So I now need to go through 3 monthly blood tests for short-term, medium-term future to make sure that there's no micro spread post-op. So if there is micro spread, it's going to be extremely early and can be dealt with radiation and drug therapy. So for me, I'm very relieved to be in the position I'm in at the moment. So that was fantastic news. So I can now breathe a little bit easier. It's something that has been stressing me since the operation was done, how I was going to go with that first hurdle, and I've leapt over it and we're away. So very relieved, guys. There's something else I wanted to talk about with these prostate issues, and that's something about we need to get a conversation going in our family. So that's fathers and grandfathers and sons talking about medical issues that are in the family. Whether it's a prostate issue, whether it's a bowel issue, whether it's a heart issue, it's a conversation. It's sometimes hard to do. It's a conversation you need to have within the family so that younger people coming through have got a heads up as to what might be coming, and they can keep an eye out for those signs and symptoms and also make their own doctor aware of what a family history is. And look, it doesn't only go for fathers, sons and grandfathers, it also goes for mothers, daughters and grandmothers. You need to have that conversation to get that background medical history of your family so that you can deal with issues or signs or symptoms as they come up. And it gives you a fantastic head start. So, as I've said, it can be uncomfortable, but look, it's something that the families probably need to sit down and do a little bit more of, and I've certainly done that with my kids. So important to try and get those little things in the closet out. I know old school, we don't talk about things like that, but it's something that we need to sort of maybe pry out a little bit and maybe ask some leading questions about issues and try and get some answers. So I think we need to do that. Look, there's so many screening techniques out there for our health. We've got bowel screening. I do bowel screening once a year. It costs $6 for the kit. It's nothing. We've got skin cancer checks that we can get done, so we can get mole maps done on ourselves. We can do simple ECGs to check heart condition. We've got cholesterol checks, diabetes checks. We've got women breast checks. We've got breast cancer checks. We've got cervical cancer checks. We've got so many different tools out there that we can use to monitor our health, and I think we really need to start looking a lot more closely at them and not thinking of them that it's not going to happen to me. For me, these PSA tests have been a life-saving tool for me, an absolute life-saving tool for me, and we need to get these tests into perspective and not be so scared of answers that we might get out of them. And we need to start pushing that a little bit harder. And I think within a family, it's probably a good way to go. So have a think about that, try and open that conversation with your family. The other thing I want to talk about as a result of this particular operation that I've had, the prostate removal, is erectile dysfunction. It's probably the elephant in the room, but it is real. Erectile dysfunction is real after this particular operation. It's going to be like this for maybe the next 6 to 18 months. During that operation, the surgeon does what's called a nerve sparing procedure, where he tries to preserve as much of those erectile nerves as he possibly can during that surgery or during that removal. Those nerves are very, very fine, and they're very, very traumatized as a result of that procedure, and they take a long time before they'll kick back into action again. And just on that, in my particular case, I had to have a fairly frank conversation with my surgeon. The prostrate is about the size of a walnut, about 1.5 inches in diameter, and the nerves backstrap around the prostrate, and there's right hand side, left hand side nerves, and then behind that is the bowel. So during that removal, the surgeon will try and preserve those nerves intact while that prostrate has come out. A lot of nerves are removed that are a part of the prostrate that do run around the outside of the prostrate, but these main nerves are the ones that he's going to try and preserve. In my particular case, my cancer was right down here, very, very close to the right hand nerves, and I had a conversation with the surgeon, and I made it quite clear to him that I wanted to preserve life, so that if the margins didn't look good during the surgery, please remove the nerves. And in my particular case, he had to remove the right hand nerves to get the margins that he was comfortable with, and I was very grateful that he did that. So my chances have been reduced slightly, diminished slightly, of getting erectile function back again, but there's still a lot of hope there for that. And look, if it doesn't come back, medical science comes to the fore again, and there's some wonderful techniques. There's even, I noticed in Melbourne now, there's been papers published on nerve transplants, which have been reasonably successful as well. So there's lots of stuff out there that can be done to bring that back. And look, I've been married to Rosemary now for nearly on 32 years. We've got four beautiful kids, and I'm so grateful for what I have as a father and husband. And that relationship at the moment, I can tell you, is just as strong as it ever has been, and I can tell you now that the feelings are exactly the same, and there's ways that you can enjoy life just as much as before if you have that really strong bonded relationship with your partner or your wife. So I'm very, 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 very blessed for that. One other thing I want to quickly touch on is the incontinence, and yes, the incontinence is still there, although it is much more manageable than where it was 3-4 weeks ago. I'm feeling a lot more comfortable with it. It's certainly reduced in the leakage rate or the flooding rate compared to what it was, and so as I said, I'm feeling a lot more comfortable with it. My surgeon said, or my specialist said, that I'd be able to go back to work next week. I have asked him for another couple of weeks off just to get a little bit better under control and just get a little bit more confidence in myself in dealing with the issue before I do go back. Just one other thing I want to leave you with, and this brings things back to what they are, and this is reality. Now, I spoke about my good mate Tony, who's going through prostate cancer. Tony had no idea or no symptoms when he was diagnosed. He had a PSA level, I think he said it was around 470, so it was sky high. He was unable to have the surgery because there was no point, because the cancer had already breached and was already into his body. So last time I spoke to you, I think he was in rehab. He just had some more radiation treatment on his hip and his leg, where he had an awful lot of pain because the cancer is now into his bones. He's still got a lot of pain there, and while he was in there towards the end of that rehab, the doctors did come to Tony and say, Tony, there's nothing more we can do for you, and Tony is now in palliative mode, so he's onto the cannabis pills now. But I did receive a message with him the morning before I went and saw my specialist. I just want to read a little bit about that, and look guys, this brings us back well and truly into reality. Okay, I'll read most of this verbatim for you, but this will give you a sense of what this cancer can do if you don't get onto it early. So I'm sure Tony won't mind me reading this out, because look, he's just the same as me. Education needs to get out there. We need to know about this. And this is the result if that education isn't out there and we take advantage of getting those testing regimes on the go. So Cam, glad to see you back in here. Enjoy watching your clips and seeing the trade from your experiences, but found some things I can help you with. Love the sodding attachment. bet you're very pleased with it. I'm back in hospital. I've lost all hearing in my left ear Saturday morning, and it's still the same on Sunday. Came into emergency, spent 24 hours there, finally got a room, have improved but still no hearing. Had my x-rays and a CT scan, and now radiation treatment is about to start. Had a plastic mask moulded over my face today, very weird. Going to use to become the new Marvel comic hero called Hole-in-One. Cancer is now in the bone between the skull and the eardrum, so I need 5 sessions. They don't know whether this is going to help the hearing much, hopefully just stop the cancer spreading through that area. The shit I've had to go through with the docs and hospital visits is unbelievable, but it will not beat me. Really missing mucking around in my workshop, but still need a walking frame from the groin treatment I've just had. I'm going to get there. Not able to drive a car, and I may not be able to drive again. Also moving in with my brother Pete. He lives down the road. He goes on about some more personal things. So Tony's having a real battle, and as I said, he's just become palliative. And I think I mentioned in that last video clip that Tony had absolutely no symptoms of his prostate cancer, none whatsoever, and it was just on a whim when he went and saw a doctor, and the doctor asked him if he'd had blood tests at some stage, and he said no. So that's when that PSA reading was found, and unfortunately surgery wasn't an option for him due to the nature of that spread. So guys, it's so real. Look, I beg you, I implore you, please go and get the PSA test done. If you're watching this, let other people know. It's so simple to get done. It's half an hour out of your life each year to go and get a test done and have a quick conversation with your doctor so you know where things are at. Like most diseases, this can be cured. It can be cured, or it can be kept at a chronic stage where it can be maintained if it gets worse. But the key is to get onto it early, fellas. Please get the test done. Get the test done, if not for yourself, for your family. I'll leave you with that thought, and just do it. I'll report back hopefully in 3 months, which is when I've got my next test done, and we'll let you know where that's heading anyway. So hopefully it's all good, and the PSA still remains at an undetectable level for the rest of my life, and that's my hope. All right, guys, we'll see you on the next one.